So many Americans are grappling with fevers, coughs, sore throats, but they're testing negative for COVID, for the flu, and for RSV. Now, doctors are trying to figure out if there's a mysterious illness going around. For more on this, I want to bring in Dr. Bernard Camins. He is the medical director of infection prevention at the Mount Sinai Health System in New York. Thanks for joining us this morning. So, people are talking about this, that they're sick, but they do a COVID test. That's what we all do automatically. Nothing's coming up. And I couldn't figure out if calling this a mysterious illness, if it just made for good headlines, or if there really is a mystery here. What's going on?
First of all, thank you very much for inviting me, Ms. Green. And I think you are right. It's not really a mystery illness. It's probably other respiratory viruses. As you know, winter is respiratory viral season, and that while there's been a lot of attention paid to COVID and the flu and even RSV this year, RSV has been around for a long time, right? It's been has become an issue before in the past, but we just haven't seen this much RSV in the community. Plus, we're actually testing more, right? We were testing more for RSV this season than ever before. So while there are these are the main three that we talk about, there are other viruses such as the rhinovirus, which causes the common cold, right? And that they can also cause the same symptoms as COVID or flu. Fever is not as common with rhinovirus, but it is still possible. So people may actually have that. Other viruses, the human metapneumovirus, parainfluenza, those can also cause, and also adenovirus I failed to mention, which is the same virus that causes pink eye or conjunctivitis. It's commonly linked with that, but it can also cause upper respiratory symptoms that can then explain why people are testing negative for COVID or flu or even RSV, but yet have respiratory symptoms. The last part is, unless you're doing a PCR test, the antigen testing for COVID is not that great, right? So potentially you can have a false negative.
That's a whole lot of stuff to worry about. Who are we seeing getting sick?
I think at this point, we're still seeing people coming in with flu and COVID, right? And these are patients who would normally have issues before the pandemic. They would be the same older population with comorbidities who then can get much sicker with flu, are the same ones who are still at high risk for COVID despite complication for COVID despite being vaccinated. For RSV, actually, it actually targets more younger kids, so babies who are less than 2 years old, and also senior citizens. So again, the same group that are at risk for complications from flu and COVID.
Okay, so we know that there are all manner of other respiratory illnesses that have always been around, but of course, we've got sort of the triple-demic that we're also dealing with. I just kept on thinking, post-holiday, we know this pattern already. People gather, we're going to see spikes. So I want to ask you, what do you predict we will see in the next couple of months in regards to these respiratory illnesses?
Well, we're hoping that because gatherings are not going to be as common anymore, that we will see that they will decline, but it doesn't mean that they will not be there. I think the best advice I can give is that, the CDC is now recommending people wear masks again indoors, especially if you're in a crowd. And that's really the advice because of COVID, right? But the same can be said about other respiratory viruses. If wearing a mask actually prevents the transmission of other respiratory viruses as well. And then the other thing would be for people, if you do have fevers and upper respiratory symptoms, even if you test negative for COVID or the flu, thinking that I've already mentioned there are other viruses that can cause this, it may be advisable for people to stay home if they can, or if they're out, to wear a mask, right? So they're less contagious.
Dr. Bernard Camins, simple, clear advice that's effective. Thank you very much.
Thank you.